Hello students, good afternoon. This is Miss Henderson, and today we will be discussing the chapter on infection control and prevention, chapter 29 in Potter and Perry textbook. So let's look at some of the students' learning objective for this chapter. As always, we start out the lesson plan by examining the student learning outcomes. So upon completion of this chapter, student will be able to describe the following concepts using critical thinking and the ability to don and remove personal protective equipment, PPE. Explain the relationship between infection chain and transmission of infection. Discuss the scientific knowledge base of infection. Discuss the body normal defense mechanism against infection. Discuss the inflammatory process as it relates to infection. Identify patients who are at increased risk for developing infection. List signs and symptoms of localized infection versus systemic infection. Differentiate between medical and surgical asepsies. Demonstrate proper technique for hand hygiene. Discuss personal protective equipment and what it involves. Demonstrate proper application of personal protective equipment and removal of PPE. Describe occupational exposure and post-exposure. Discuss concept maps to deepen your understanding of contact precautions. Use case studies to enhance your knowledge of the content. So the first slide we have here is the scientific knowledge. So infection. What is infection? Infection is the invasion of susceptible host by a pathogen or microorganism that results in a disease process. Examples of infectious agents include bacteria, viruses, fungi, and protozoa. So as we can see, there are different types of microorganisms that are responsible for infection. Let's say you have a patient comes in and they're running a temperature of maybe 102. They're coughing and they're bringing up a lot of thick mucus secretion, yellow color, and it has a foul odor. So as a nurse, based on those clinical assessment, you can probably anticipate that or the patient might be having a bacterial infection. So you will call the doctor, you will let him know of your clinical findings, your vital signs, and your auscultation of the lungs. Did you hear any advantageous sounds? Were the breath sounds normal? And so on and so forth. And then the doctor may order a chest x-ray, a culture of the sputum, and maybe start the patient on a broad spectrum antibiotics. So what is an example of a virus? So the influenza, for example, patients have the common flu. That's a virus. We don't treat viruses with antibiotics. So how about fungi? If somebody have a yeast infection, you might anticipate they might have a fungi infection. So colonization is the presence and growth of microorganisms within a host without tissue invasion or damage. Virulence. So virulence is the ability of the microorganism to cause a disease depending on the number of microbes present. Communicable diseases, infectious process transmitted from one person to another through physical contact, sexual intercourse such as gonorrhea, HIV, hepatitis A, or droplets, influenza, or TB. Symptomatic. So symptomatic has to do with the clinical signs and symptoms of the disease that is present. So as I say, if somebody have a, let's say a patient comes in and they're presenting, they're complaining of burning sensation upon urination. They complaining of pain and tenderness by the lower pelvis area, and it radiates to the back area. So they're also running a temperature, and their urine is very concentrated and has a foul odor. So as a nurse, you can anticipate that maybe off the bat that they might be having a urinary tract infection. You will call the doctor, you will inform him or her of your clinical findings, and the doctor may order a urinalysis, and may also want to start the patient on a broad spectrum antibiotics, awaiting the UA and CNS results. Asymptomatic, sometimes patients like elderly patients may be having a urinary tract infections, and they might not demonstrate the classical symptoms as a younger person. Geriatric patients, they might, have an increase in confusion, but they might not run a temperature. So the chain of infection has 6 links. So as we said, the infectious agents are bacteria, viruses, fungi, protozoa, and worms. So the second link of the chain of infection is reservoir. So what is a reservoir? A reservoir is a place where the microorganism grows and multiplies. And the ideal environment that a microorganism survives and grow is a dark, moist environment, such as a surgical wound. A surgical wound is very dark underneath the dressing, it's moist, and it's a perfect medium for the microorganism to survive. The most common place where microbes grow is in the human body and also in animals. So port of exit is the third link. So the portal of exit, microorganism can exit the body when you're blowing your nose and sneezing, through the skin, through the gastrointestinal tract, like you're having diarrhea. That's a way of getting rid of the microorganism. Also the mucous membrane and the respiratory tract. So modes of transmission, you have direct and you also have indirect modes. Portal of entry, it's basically the same route that the portal of exit. That the same way the microorganism enters the body, the same way it exits the body. So how about susceptible hosts? Patients that are more susceptible to infections are those patients that are immunocompromised. So like our HIV patients, like patients with stage 4 advanced cancer, patient whose nutritional status is compromised, those patients are at increased risk for infection. I have a simple NCLEX style question here, and I'm going to read it for you. The nurse is caring for a patient on contact precautions. Which action will be most appropriate to minimize the transmission of the disease? So as we know, contact precautions are diseases that is transmitted through contact or by touching inanimate objects. Contact precautions, examples of Contact precautions are patients that like have MRSA, methicillin-resistant Staphylococcus aureus, patients that have C. diff toxin. Those patients are placed on contact precautions. So the answer is D. Use a dedicated blood pressure cuff that stays in the room and is used for that patient only. So by having a dedicated blood pressure cuff for that specific patient, you're minimizing the transmission of the infection. So also it's important that patients with on contact precautions, as a nurse, if you have, let's say, you have 4 patients and you have 2 patients that have C. diff, and you have 2 patients that maybe have, let's say, that are on droplet precautions. So the patients that with C. diff, you will cohort them into the same room. Cohort means that you place 2 patients into the same room that has the same infection, so that way that you're minimizing the transmission of the infection. Also, patients are on contact precautions. It's important that you know that you apply proper personal protective equipment. There will be also a sign at the door to see the nurse. You probably gonna have a setup at the door, like with your gowns and your masks and your gloves and so on and so forth. I have another NCLEX style question here. Which of the following is an example of a nosocomial infection? So a nosocomial infection, in order to answer this question, you should know a nosocomial infection is an infection that occurs in the hospital, and it's attributed directly that something that the nurse is doing. For example, if the patient has a central line and the patient, you're doing a dressing change on a central line, which is should be strictly a sterile technique. And if the nurse breaks that sterility, then she's introducing microorganism into the site, and the patient can have a can acquire a nosocomial infection. Also, another example of a nosocomial infection, if a nurse is inserting a, let's say, a Foley catheter, and the nurse broke sterility, and she can introduce the patient to a catheter-associated infection. So those are examples of nosocomial infections or hospital-acquired infections. So the question says, which of the following is an example of nosocomial infection? The answer is C. An infection developed at the intravenous infusion site because of poor insertion technique. As I said before, the nurse probably didn't follow strict sterility while doing the procedure. I have another NCLEX style question here. This one is, which of the following nursing measures should the nurse do first? A child is admitted to the pediatric unit with a diagnosis of suspected meningococcal meningitis. So as we know, meningococcal meningitis is a bacterial infection, and it's the infection of the brain, the lining that covers the brain and the spinal cord. And clients should be placed in a private room. It's a very, very, very contagious bacteria. So patients that have meningococcal meningitis should be placed in a respiratory isolation, and the nurse should implement respiratory isolation for this patient using the appropriate PPE and personal protective equipment. Personal protective equipments or equipments that are used in the healthcare in